Okay, so I'm having a heck of a time memorizing these drugs, so I figured I'd make a video and hopefully it'll help you too. Okay, so I'm doing antipsychotics, and I kind of broke them up into two sections. This side here is the typical antipsychotics, and they're stronger and they're more likely to cause the EPS symptoms. And these ones here are the atypical antipsychotics, which are, you actually see more of this in the hospital, which is what I've noticed, and the symptoms aren't as strong, but they the patients often get a lot of weight gain, and if they're diabetic patients, you really have to watch their blood sugar. I noticed that more with the atypicals. So how to help me remember is I broke them up into zines, and these are the antipsychotics: fluphenazine, perfenazine, prochlorperazine, trifluoperazine, theodorazine, I think that's how you say that, or theordazine, theothizine. I know this is not spelled Z-I-N-E, but I just figured just put it in there, make it easier. So the zines. So remember, if you see zines, highly likely, and if you're talking about antipsychotics or a schizophrenic patient or something like that, you're probably talking about the typical antipsychotics, okay? And then these three here don't really fit in the zines. They're the non-zines, and haloperidol, you see that a lot. Melindone, I think that's how you say it. I haven't really seen that. And loxapine. So these are three that don't really fit in the zines. So I put HML, haloperidol, melindone, and loxapine. Hope you can remember that. So HML, okay? Now the atypical antipsychotics, I put them under ol, own, or ein. I notice they all end in ol, own, or ein, at least the ones that she has on the list, Ms. Brent has on the list. So it's paliperidone, ziprasidone, risperidone, olanzapine, I don't know how to say this, quintiapine, that's Seroquel, by the way, that's a lot easier to say, and clozapine, which is the famous one, right? That one causes agranulocytosis, the hypersalivation. That one we're a lot more worried about, and this one also causes EPS, unlike these other atypical ones that don't really cause that as much. And then I think you pronounce this aripiprazole, but that's Abilify. You'll see that a lot at the hospital as well. So I hope that helps. The zines, the non-zines, which are HML, haloperidol, melindone, loxapine, okay, and the atypical antipsychotics, the ol, the owns, and the eins, okay? You got the paliperidone, ziprasidone, risperidone, olanzapine, clozapine, quintiapine, and then this ol, aripiprazole, which is Abilify, okay? Hopefully that helps you remember. Now, the side effects you really need to know is obviously EPS, right? Because these guys over here, you're going to see a lot more of the EPS because they're dopamine blockers, strong D2 blockers, okay? So with the EPS, you know that they're going to get the movements such as akathisia, I think that's what it's called, where they have muscle weakness, and then there's one with the eyes that they roll back, and it looks like they're having a seizure. And when you do see that, you're gonna let the doctor know, because the doctor might probably stop the drug and then give the patient cogentin, right? Because cogentin is to control the EPS symptoms. Okay, so EPS, remember, that's highly likely with the zines and the typical antipsychotics, which are stronger. Okay, they all have a sedative effect. The weight gain you're going to see more with the atypical. And then you're going to see orthostatic hypotension, different variations with all of these. Okay, and then you know that they have the anticholinergic effect. Okay, so you're going to get the dry mouth, the blurred vision, the urinary retention, the constipation, all the things that basically, like those anticholinergic effects. For the most part, they also get photosensitivity. I haven't seen a lot of questions regarding photosensitivity, but for the most part, they all cause that to some effect, so I put it on there anyways. And then there are hormonal changes to some effect for the most part. It seems more with the typicals, I believe, and the guys get the gynecomastia, where they get breast, and Sometimes girls get amenorrhea, but you can just let the patient know that those symptoms are reversible for the most part, as far as the book says. Okay, so side effects. Now, the important one, neuroleptic malignant syndrome. And I kind of had trouble memorizing that one, but so when you hear neuroleptic, you're going to remember that it goes with the antipsychotic drugs, because you know antipsychotic drugs are also known as neuroleptics. Okay, so remember, when you see neuroleptic malignant syndrome, you're going to know it's associated somehow with antipsychotic drugs. Now, how to remember that? I basically just thought of maybe like somebody who's schizophrenic and they're running. So the symptoms are, let's say you're running, right? So your heart's going to be beating fast, so right, you're going to have tachycardia, okay? You're running. And your temperature's going to go up, right, because you're getting a workout. So increased temp. And because you're running, you're going to be sweating, right? So you're going to have diaphoresis. If I'm spelling this right, and if not, sorry. And so we got the tachy, the temp, and then you're going to be breathing hard, right, because you're running, so you're going to have tachypnea, right? And then let's say you're running and it's really hot, all these things are happening and you're becoming dehydrated, so maybe you have fluctuations in blood pressure, right, because you're utilizing a lot of your fluids. So BP, I'm going to put up and down, so you're going to have fluctuations. And then you're going to see these patients be kind of like their mental status really decompensates. So possibly even coma. So pretend that you're running and all these things are going on in your body. Your heart's beating fast, you're spiking a temp, you're sweating, you're breathing really fast, you have tachypnea, your blood pressure's all over the place, and eventually you're just going to pass out. So maybe you have a decline in mental status. So hopefully that helps. Antipsychotics, the zines, the non-zines, which is haloperidol, melindone and loxapine, and then the ol-ons and ines, okay? And remember, EPS, strong with the typicals. Weight gain, strong with the atypicals. And you're going to see a lot of these atypicals with the psych patients. I've noticed that. And then neuroleptic malignant syndrome. Imagine a guy that has schizophrenia and he's running, and these are all the things that are happening as he's running. And if ever in doubt, when a patient is at risk for neuroleptic malignant syndrome, remember, neuroleptic. Antipsychotics are also called neuroleptics. All right, I hope that helps.